Hey everybody, welcome back to Ask Lex Rx. I'm Dr. Lexi, the functional medicine pharmacist at River City Pharmacy in Decatur, Alabama. And today I am going over something that we have started to see a little bit more lately, and that is the vitamin D you get from sunshine. What is the deal with vitamin D anyway? Why is it such a big deal, and why is it so important? So I'm just going to kind of lightly go over several of the different areas that vitamin D impacts, because it acts more like a hormone than a vitamin. So I want to share with you all the, just a hint overview of the different areas that it impacts in your body. So probably the most commonly known one is bone formation. And it actually ties hand in hand with blood vessel health. And I'll tell you why real quick. Vitamin D actually works with vitamin K2 to help pull the calcium out of your blood vessels and into your bones to make strong bones. So even if you're taking a vitamin or a calcium supplement, if you're not taking the vitamin D, and then if you're over 45 and not also taking vitamin K2, then some of that calcium may not be getting out of your blood vessels and can be causing your blood vessels to become more stiff, which leads to things like high blood pressure and heart disease. So some of the trends show that people with heart disease and high blood pressure, even with diabetes, and if you're obese, tend to show that your vitamin D levels aren't as high as they should be. Now, I will caveat that with the normal lab range of a blood vitamin D level is 30 or above, and that's in nanograms per milliliter. But that's not necessarily optimal. It's just being above 30. A lot of people need to be in the 50 to 80 range. So keep that in mind, that just because your vitamin D level is normal doesn't mean it's optimal. Okay, so a few other things that it's really, really involved in is your immune system, which makes sense because with all of this COVID stuff and allergies and the cold and the flu, which has been absent this year, but we've been talking about vitamin D all year. So very, very important with your immune system. Your immune system cannot function as it should without vitamin D, which is why sunshine is so important. Okay, now other things you may not be thinking of when it comes to vitamin D is brain function. And I'm talking your mood, your memory, just all things brain. Vitamin D impacts all of that. So that's something to keep in mind. And then I went over artery health. So how do you get vitamin D, especially if it's raining, right? Because vitamin D comes from sunlight. And so I've got a few suggestions. One, of course, you can always take a vitamin D supplement. Please ask your pharmacist or me if you want to shoot me a quick question on how much you should be taking. I usually recommend anywhere from 1,000 all the way to 10,000 units a day, depending on the individual person, if they have lab levels, what their daily life looks like. Like for myself, I take more on the higher side because I'm indoors all day because of my job. I don't get to see the sun very often, so hence pasty. Anyway, it's all good. So other ways that you can get vitamin D is through food. Although I will say that getting it through the sunlight is the best way, but you can also get vitamin D through food. So I'm talking things like beef liver, yum, right? Cheese, egg yolks, and fatty fish. So things like salmon, and sardines and herring. So there's lots of ways you can get vitamin D. It's not just in the sunlight. And I will say, last little tidbit of information for today, if you wear sunscreen outside, you will not absorb or be making vitamin D. So it is good to get at least like 10 to 15 minutes without sunscreen to make sure that you can get that vitamin D going. So, all right, that was a lot of information, but let me know if you have any questions. And with that, I will see you guys next week. Bye.